America's healthcare advocate, Cary Hall.
Hello, America. Welcome to America's Healthcare Advocate Show, broadcasting coast to coast across the USA here on the HI Radio Network. You can find out more about us by going to the website, americashealthcareadvocate.com. All of our shows are posted up there, as well as our podcast platform and YouTube platform. By the way, I want to thank everybody in the audience. We are up to 429,873 views on YouTube and 107,078 plays on our podcast platforms. Dave Thiessen provided me with all of that information the other day, and I was quite surprised to see the numbers up so high. So we thank all of you out there, and those of you listening on terrestrial radio to our over 200 stations around the country. In studio with me today, we have two guests from Hy-Vee Exemplar Care. Dr. John Veer is here, and Jackie Robson here from Hy-Vee Exemplar Care. I want to welcome you to the studio today.
Thank you.
We're going to have a fascinating show today. If you're an individual on an ACA, or as I call it, Obamacare health insurance policy, or even if you're a small employer or a large employer, you're probably dealt with what's going on in this marketplace in terms of high costs, high deductibles, not a lot of care for your employees, a lot of dissatisfaction with these plans as the years have gone on. We're going to talk about a model today that is significantly different. It's an opportunity for primary care direct pay membership in a program that we think is going to make a big difference here in the Kansas City Metro. So with that, I want to go to Dr. John Veer. Doctor, so how did you come up with this model and this concept? This is your baby.
It's a lot of people's babies, but yes, this version is mine. So the idea of direct primary care has kind of been out in the ether for a while, and I basically like you said, you're a recovering broker. I am a recovering fee-for-service doctor, and it took kind of a breaking point and burnout to really realize there's a better way to deliver care and then for the patients to receive care. So this model just allows for that type of interaction to take place.
So Jackie, talk a little bit about the membership model and how this works and how this is significantly different than what we see in a typical primary care practice. Jackie?
So the membership model is that for a monthly membership, you can receive all services that we provide in our clinics, which is all services primary care or urgent care. So 80% of what most people's healthcare needs are.
One of the things that when I was researching this and going through the website and looking at how this is offered and where it's different than what we see in typical primary care, the average time spent with a primary care doctor in this country is 7.5 minutes. One of the things, which is not good, doctor, one of the things that's emphasized in your model is the time spent with the patient, the ability to listen to what the patient has to say, and then be able to translate that into a program that's going to make a difference in terms of their care, their ongoing care, disease management, and healthcare. So let's talk a little bit about that.
You hit that exactly on the head. So everyone wants to practice evidence-based medicine, but people don't often talk about the fact that the time spent with a patient often leads to more accurate diagnoses and thus better treatment plans. In our model, we have 30-minute follow-up visits, 60-minute new patient visits. I've had new visits as long as 2 hours. So it's not that rat race where how fast can you get someone through to get on to the next person, because in a traditional system, your job is to see them, triage them, and move them on to whatever specialist or other care pieces downstream. In this, our alignment of the better I take care of you, the better you feel, the less I have to see you, which actually goes into a membership model. The better I'm doing, the less work I have to do. But at the same time, when you need me, I then have time and availability to actually spend with you.
So, Jackie, talk a little bit about the convenience of this. I mean, these are in the Hy-Vee stores now. We have them here in Lee Summit and Overland Park in the Kansas City Metro. You've been in Iowa and Nebraska for some time. So talk a little bit about that and how that model works, again, differently than the primary care model, where you may wait 2 weeks or a month to see your primary care doctor. This is significantly different.
It is significantly different, and they're not actually in the Hy-Vee stores. They're near to or close to a Hy-Vee store so that we can work with Hy-Vee and help them to take care for their employees. So they're actually close to near to a Hy-Vee store. Yes, we now have one in Lee Summit, and here in Overland Park, it's at West 135th Street. And the convenience of it is that people can come see the longer appointments, and then once they've actually established, they can connect with the doctor provider any way they need to from where they're at. So they can send messages, they can do virtual, they can have those calls with them from whenever they need to, wherever they need to, get the care that they want, and it's all included in that membership.
Can I share an example quickly?
Yes, that would be
So we were driving from West Des Moines down to Kansas City Market today, and I received a phone call from a patient who said, "Hey, I've got a rash. This is what's been going on." I said, "Well, I'm not in Des Moines today, but somebody could see you, or if you want to shoot me some pictures, you can." So he sends me pictures. I looked at it. He has shingles, and his antibiotic or his antiviral has now been sent in across the state line to his regular pharmacy, and he's getting the care he needs without having to even step foot in a clinic.
So, that's remarkable because they were able to resolve that problem right away and not have to wait to get an appointment and come in. Can they connect when your members, your patients connect? Do they come back to the same doctor each and every time if that doctor's available? How does that work, doctor?
They do. They also, we like to view Hy-Vee Health Exemplar Care kind of as the provider. If you're a member in West Des Moines and you're watching a Chiefs game, you can go into the Overland Park Clinic and be seen just like any other member. So yes, you can see the same person for continuity on the primary care side, but if you have a need that you just need taken care of, the entire system is built to take care of members.
And so if they're not in their particular metro, for if they happen to be in Des Moines, or I'm back and forth to Nebraska all the time, you would be able to go into any of the Hy-Vee Exemplar clinics and do this.
And you get moved to the front of the line, you get treated like a member. It doesn't matter where you're at.
So what prompted Hy-Vee to do this partnership with you, Jackie? Talk a little bit about that, because this is unusual.
I think that might be a better John question.
Okay.
Obviously, Hy-Vee has assets in pharmacy, the PBM space, specialty pharmacy, dietary, dietitians, all sorts of different components. So it made sense that they were moving towards primary care, and they'd been looking, and we met with Dr. Fick, who's their chief medical officer, introduced him to our model. And we walked through what benefits this could have for them as an employer, both taking care of employees and then also serving the communities we're in.
Their employees are actually in this program.
Yes, absolutely.
So Hy-Vee's this is not just something they're doing in the community. They're invested in this from the standpoint of they're putting their employees in the program for this care model.
Yes, wherever we are located, we get access to that set of employees, or as we call them, patients, and start providing services directly to them.
That's very unusual, Jackie.
It absolutely is. And what we're finding is once companies are putting their employees into this care model, the engagement of those employees with their health is significantly increased. So people who may not have had their annual physical, or that's all they're having, they're actually coming in and having that. And so they're seeing that they're having their annual physical. And then we're finding rather than somebody who sees a doctor once a year, they're maybe coming in 3 or 4 times a year because they're using those doctors and providers as advocates and coaches to be proactive about their health going forward, whether it's weight management or help with sleep or mental health. Whereas prior to coming into these programs, they were managing it themselves and maybe talking to Dr. Google.
And a lot of times they were gun-shy.
No, Dr. Google.
A lot of times
my wife talks to Dr. Google a lot, so I understand that comment, Jackie.
From the financial standpoint, employees are often gun-shy. They don't know what something's going to cost. I mean, a urine test could be $1.30 or it could be $200. That's the issue. They don't know. And in this model, the employer is covering their membership, and they come in and every service we provide in-house is included. So they know they're not going to pay anything.
So I think you can see this is a very different model. We're going to go into more of the details regarding the model. We're going to talk about how, if you're an employer, this could make a huge difference for you. Also, if you're on an ACA plan, get ready for some market disruption in the fourth quarter of this year. So we're going to talk more about that with our guests in studio here. Stay tuned. We'll be right back after the break. If you want information, the website is exemplar.care. Exemplar exemplar.care. It's not .com. It's just exemplar.care. They've got a great website. All the information is up there. You can reach out to them. They'll be happy to chat with you if you're an employer or an individual and you want to see what this model is all about, or even take a tour of one of their facilities. Stay right there. We'll be right back after the break. You're listening to America's Healthcare Advocate, broadcasting here on the HIA Radio Network, coast to coast across the USA. We've got more. Welcome back. You're listening to America's Healthcare Advocate Show, broadcasting coast to coast across the USA here on the HIA Radio Network. My producers today, Mr. Garner Cowdery behind the microphones and Mr. Dave Thiessen behind the cameras, puts all these shows together, all those YouTube views you see and those podcast platforms, all 15 of them. Dave's the one that puts all that up there. Very happy to have them in studio with us today doing this, obviously. And Dr. John Vanderveer, he is the CEO of Hy-Vee Exemplar Health, and Jackie Robson, she's the VP of Hy-Vee Exemplar Healthcare Membership Services, and we're happy to have them in studio talking about this very different model that's now available here in the Kansas City Metro with 2 clinics in Overland Park, at least some. We'll talk more about that in a minute. A little bit about Dr. Vanderveer is a DO and MBA, is a board-certified internal medicine physician and the CEO and founder of Hy-Vee Health Exemplar Care, a membership-based clinic focused on personalized, accessible healthcare. He's got 20 years of experience in hospital and internal medicine, and he brings this patient-centered approach to this model. Jackie Robson is the Vice President of Member Service at Hy-Vee Exemplar Health. She helps with most of the innovative models at direct care and primary care and urgent care. We're happy to have them in the studio with us. So let's continue with this conversation and talk a little bit about all the services included for this one single membership fee. No more co-pays, no more deductibles. I made notes this morning. No more co-insurance, no more out-of-pocket maxes. All that goes away. So let's talk about what those services are, Doctor.
So, like you said, it's kind of one and done. There's the monthly membership fee, and that includes your in-person visits, your annual visit, virtual care, texting, portal messages, any way you choose to communicate to get your care provided. In addition to the actual care, there's then lab services included. Depending on states, there are generic medications dispensed out of the clinic. Additionally, we are set up for X-ray, so for plain films, as markets grow and mature, we'll have X-ray in all of those locations. And then additionally, there is DME, so durable medical equipment. This is the slings or crutches or things you may need if you have an accident or need something. I think that hits just about all of them.
So that's basically, Jackie, everything that you would get in a primary care clinic and then more. Because so you need a lab. Right, now I got to schedule my labs at Quest or wherever I have to go. Then I have to drive there and get that lab done. If I'm at the Hy-Vee Exemplar Care Health Facility, I get the lab is done right there.
Absolutely. It's a complete one-stop shop where you're coming in and you're meeting with your provider, and then you're leaving with whatever you're needing to manage that care that you need. I think we should also at some point as well speak about the types of membership costs, because the membership itself, it sounds when you're speaking about a membership and people say, this is a lot of service that I'm receiving. So the actual costs for an individual are $89 a month. So $89 a month for an individual, $158 a month for a couple, or $216 a month for a family. And a family would be 2 adults and 2 or more children. So we are speaking affordable here as well, but it's much more not about the cost, it's about the quality and the quantity of the services that you're receiving for that cost.
So you can get care how you want, when you want, for less than the price of a cup of Starbucks a day.
That's a really good comparison. Less than a cup of Starbucks a day. When I look at that versus what I'm going to do on an ACA Obamacare policy, or what I'm going to do on a small group health insurance policy where you've got copays for labs, you got the copay to see the primary care doctor. You and the primary care doctor says right on the desk of the receptionist, you're responsible for the copay before you go see the doctor.
Yes.
This is completely different.
It's absolutely completely different. And what we find is it's also unlimited visits. We don't encourage it, but you can absolutely come and see us every day if you wanted to. But John has patients.
On the air, you're going to get a lot.
John has patients who do message him on a regular basis. He has patients who he speaks to.
It's a different way to care.
Like he was doing it today.
Like he was doing today. So we do have that, and people do like the model because they talk to their provider more regularly.
With the model, Cary, I think one of the most important things is if you change the financial model, you change the care model. Absolutely. And that's where everything gets stuck. The fee-for-service world that exists right now, it is perfectly incentivized to give us what we all think of as sick care. That's right. It's built and it delivers exactly what it was designed to do, accidentally designed. And this is changing the model, and it changes how the care is delivered.
So you talked a little earlier about the fact that people are managing their disease, managing their wellness, their health. They're going in to see the doctor more often. They're doing the things they need to do. Obviously, not having these roadblocks in front of them with the copay every time they turn around. I've got to get a piece of durable medical equipment. I've got a full deductible and coinsurance I have to pay before I can access that equipment. I need a lab. Well, that's $150 or $800 depending on the lab. So that has to have a direct impact on this, yes?
Absolutely. Can I tell a DM? Sorry, Jackie. Can I tell a quick DME story? We had a gal who came into an urgent care facility of ours and said, my daughter's here. She was hurt. She needed a sling. We said, we'll sell you the sling. She wasn't a member, but we still served the public as well. Said, we'll sell you the sling for $20. And she goes, I have the best insurance in the state. I want to have it billed to my insurance. She got her bill for $197. It was our first and only, one-star Google review blasting us for her having to pay $197 for a sling. We offered to her for $20, and she said, well, I could have bought the same one for $15 at Walmart. Well, they have better buying power than we do. So it shows that people don't even understand what their insurance does, how it's going to impact them financially, where we make it as clear and transparent as possible.
Yeah, well, there's a reason that the big hospital systems that run these primary care practices don't publish their rates, where you can see what the cost is to have this visit or that visit or another visit. There's a reason for that, okay? And a lot of that has to do with the negotiated price they put in place with the primary carriers, the big carriers, the Blue Crosses, the Uniteds, the Aetnas, the Cignas, the AM Betters, go down the list, okay? And that's got a lot of impact on how this works, and that's why people are spending so much money on a lot of this. What you're doing is you're cutting through all of that and saying, here, for $89 a month, you can come in here and get everything you need done. We'll talk about in the next segment what happens when you have to be referred out and how that functions. But the point is, 90% of what people do is right there with their primary care doc. Am I right or wrong?
Absolutely. That's exactly it.
100%.
And we're also finding that some of the primary care through the hospital systems are actually billing at hospital rates.
That depends on their facilities and where they're structured at.
And so, and the problem with that is obviously all this comes back to the user in terms of premium.
Yes.
And that's why you see, and that's why you're going to see this year in the fourth quarter, especially if you're on one of these ACA plans, and I intend to talk about this in great detail in an upcoming broadcast, but you're going to see rate increases of 25% or better across the board on most of the ACA plans. Some of that has to do with moving out of the market. All of these things that are going to happen out here. So this is a model that is here today to serve today that makes a huge difference in the way care is being delivered and an even greater difference in the cost. If you want information, it's exemplar.care. Exemplar.care. That's the website. It's a beautiful website. Ton of information up there. You can go up there and find out about it. If you're an employer, I urge you to take a look at this. If you're an individual and you're paying these high premiums, this is a great way to get out of that hole and start getting a better form of care. You're listening to America's Healthcare Advocate, broadcasting here on the HIA Radio Network, coast to coast across the USA. Stay right there. The doctor's in the house. We'll be right back. Welcome back. You're listening to America's Healthcare Advocate Show, broadcasting coast to coast across the USA here on the HI Radio Network. Want to give a shout out to KBGB 1590 AM, 97.7 FM on Saturdays from 11 to 12 in Great Bend, Kansas. One of our best affiliates in the state of Kansas. Want to say hello to all those folks out there in that listening audience that listen to our broadcast every week. So we're going to shift gears now. There's a lot of disruption coming in the fourth quarter. I talked a little bit just a minute ago as we went out of that segment of what we're going to see in the individual marketplace. Well, it's going to be similar to what we're going to see in the small group space next year. You're going to see significant increases across the board. You're also going to see a very narrowing of networks. This is one of the ways that carriers control costs is by controlling access. Well, we're going to look at that versus this model, the Hy-Vee Exemplar care model, and talk about what those differences are and how that works and how that impacts cost to you as an employer. So instead of cost shifting, raising the deductibles, raising the copay, raising the out-of-pockets, and putting that burden on your employers, you're going to have an opportunity to hear how this program does just the opposite of that. So let's just start right there, Doctor. To me, and David Hickman just walked in the studio here, a broker here in the Kansas City Metro I've worked with for about 16 years, and we've talked about this extensively. To me, this is a tremendous alternative for the small group employer out there that is really getting hammered with the benefits are going down, the cost is going up. As I said, there's a lot of cost shifting, pushing it more onto the employer. The employee, this is significantly different. Talk about that a little bit and how this model works for employers and what are employers finding in the way of satisfaction with this?
So employers are very satisfied with it. First off, because it's affordable to them and it helps them manage some of their costs. Secondly, it allows them to provide what we've had some employees define as the only true benefit my company offers me. And they said it. We've got it written down. The employee, though, is the one, like you said, who's been carrying more and more of the burden. And as we all know, the vast majority of people can't tolerate a $1,000 bill, but they have a $7,000 deductible. They can't afford care that they need. And in this model, they have a benefit that they know it's paid for, it's covered, and all the care they get is going to be included. They're not going to have a surprise bill. There's not going to be a lab fee. There's not going to be a visit, a copay, a coinsurance, a deductible. Nothing's going to show up. And that's why they view it as a true benefit. They can get care that they've avoided in the past because they didn't know what it was going to do to their own finances. How does that, Jackie, affect the overall health of the employees as a group and for the employer in terms of things like absenteeism and, trying to get to a doctor's appointment they can't get to because they can't get there in time. They got to take time off work. This all changes now. Talk a little bit about that.
It absolutely changes. So we are much healthy, happier employees, more engaged employees. And from the employer's point of view, as the employees are able to get that same day or next day appointments, they get seen when they need to be seen. If they're not able to get into a clinic, they can connect with their provider and they can manage the care that they need, get that prescription that day and be back at work or be getting healthier as they move forward if they've had some of those conversations with the provider regarding long-term concerns.
So the employer can take a high deductible plan like an HSA or an HRA. They can wrap that around this model where the primary care is all handled by the Hy-Vee Exemplar care primary care model. And if an employee needs to go out to a doctor for an orthopedic surgery or another type of procedure, talk about how you work within that particular network to help them coordinate that so they get this the best level of care in that network, Doctor.
So again, because we have the time to go through people's medical information and you have their insurance plan, you understand where they can get care and where they can afford care. First off, every clinician in every market knows where quality providers are. So assuming that the network has quality providers in it, you can direct those people directly to those providers as long as they're in network. You know which ones are going to be more cost effective for those employees. And if it's a different funding model, a level funded, self-funded, you can actually go to the most cost effective for the employer as well. But ultimately the employee will have choice. They're going to say, this is who I recommend. My neighbor's this person. Okay, they're in network too. So you have the time to actually evaluate and send people where they should go, instead of just this is the one that's in a system. So you go up a system and you go from primary care to specialty care with no real regard to cost or quality.
So, Jackie, when this occurs now, is the primary care doctor, clinician at the Hy-Vee Exemplar Care Clinic, they're following along to see how the care is being delivered and if there's follow-up, whatever the case may be?
Oh, absolutely. The providers at Hy-Vee Health Exemplar Care, they're advocates, they're coaches, they're navigators. They will help people to understand the complexity of the healthcare system and make sure that their patients, our members, are receiving the care that they need.
So there's a coordination between the two groups.
We are the quarterback. That's how I always view it, is the primary care team at Hy-Vee Health Exemplar Care is responsible for getting you in and seen, and then if you do need to go somewhere, out to get the care you need, and then to close the loop and bring you back in and move you forward with the appropriate recommendations you receive.
So you said something at the beginning of this segment that was kind of interesting. Some of the employees have said, this is the only benefit my employer really provides. Do you think that kind of a testimonial to what you're doing results from the fact that they are not coming in and getting blown out the door in 7.5 minutes and handed 3 prescriptions and out the door they go? Or how impactful do you think it is that you said you've had people spend as much of an hour sitting and talking to you? You took a call today on the way in here from Iowa, talking to a man who had shingles and got a prescription for him. So that's unheard of. You try to call a primary care physician, you're going to get the nurse, if you're lucky, and then she's going to call you back between the hours of so-and-so and 3 o'clock, if you're lucky.
Absolutely.
And if you miss that or you don't get that call, you're not going to talk to them at all.
Nope.
But I look at that versus here you are, the CEO running this whole program, and you're taking calls and talk. How much do you think that statement made by that employee or employees you've talked to has to do with the fact that they can access this care and somebody really gives a damn?
I think that's solely what it is. Their life matters more than how we want to run our clinic. So their convenience is their first priority. Their health is their first priority. And we're a delivery mechanism to meet their need. Healthcare has quit being a service organization and it's a widget producing factory, where here it's all about relationships. The better you know somebody, the easier they are to care for. If you know all their history, you can take a phone call on I-35 and take care of somebody because you know everything about them. So those relationships are essential, and people feel that. I mean, nobody wants to be hurried through like they're cattle.
Yeah, and unfortunately, that's the way the system's set up.
And I think, as John's exactly said it's an experience. It's something you need to feel. You need to come in and feel the difference. It's a different way of doing healthcare, and until you've actually experienced it, it isn't easy to explain it and understand how that feels. It's a little bit like the Disney magic. How do you explain what that experience is?
People always say that it's too good to be true. This can't be how you take care of people.
No. And I felt listened to. I felt heard. I've had this conversation with multiple people in the past. This is the first time somebody's actually heard what I was saying and listened to what I said.
Because they took the time.
It's all about time and access,
because
convenience.
As you talked about, primary care doctors are taxed with seeing how many hundreds of patients they have, moving them through the system as quickly as they can and getting to the next patient.
Internal medicine, 2,500 patient panels. Family medicine, 3,000 to 5,000 patient panels.
You're serious?
Yeah. And I was at 1,900 when I left the fee-for-service world on my way to 2,500 as an internist. Average age, 76. Not the easiest population to take care of.
Yeah, I'm 76.
And there you go. I nailed
You're
it.
a wonderful 76.
And then now panels in direct primary care, 500, 800, 1,000 if it's a healthy population. It's a fraction of the people, and we don't need to see a certain number to bill them. You just change the model.
Already paid their membership. And I'd like to add to a story with that. I was talking to a cardiologist, and he advised me he sees 10 patients a day. He works in a system where he gets referrals through the primary care, through the system. He said of those 10 patients a day, he only needs to see 3. And of the other 7, they didn't need to be there if the primary care provider had been able, not the primary care provider's fault, the system, if the primary care provider had spent the time with them. Each of those 10 patients is paying $3,000 each for that visit with him. And 7 of them a day do not need to meet with him.
And what do you think has to do with why they're doing that? That's one reason why United Healthcare is under investigation right now by the DOJ, because of those kinds of referrals and charges that they are saying are unnecessary. So, yeah, there's a lot that needs to be fixed.
It's a broken system.
It is a broken system. But this is a great system, and it's a system that can work. And if it sounds like something you'd be interested in, you should go to the website, exemplar.care, exemplar.care. You'll see everything up there. If you're an employer, you can send them a quick message. They'll be happy to have someone come out and talk with you. If you're an individual, the same thing. Or better yet, go to one of the clinics, walk around and see what you think of it. You'll probably be surprised by what you learn. We'll be right back after the break. You're listening to America's Healthcare Advocate, broadcasting coast to coast across the USA here on the HIA Radio Network. We're going to shift gears now and talk a little about what big employers do when they're on this plan. Stay right there. We'll be right back with more. Welcome back. You're listening to America's Healthcare Advocate Show, broadcasting coast to coast across the USA here on the HIA Radio Network. You can find out more about us by going to our website, America's Healthcare Advocate. Also, 15 podcast platforms, YouTube. So here's the thing. Maybe your company has got a health insurance plan and nobody's happy. Maybe you might want to mention to them, hey, go up and listen to this broadcast that Cary Hall did with the doctor in studio and talked about this Hy-Vee exemplar care model and how it works, and let them know that it's there. Because oftentimes when people refer other people to these podcasts, we get a lot of feedback on this, the podcast and the YouTube. You don't have to be able to relate this whole broadcast back to someone if you think there's someone to be interested in this. Maybe it's a family and you think maybe it's your wife and you want to tell your wife to go listen to this podcast. This is a great way to do this. We're posted on 15 podcast channels. We have our own YouTube channel. We've got almost 500,000 views up there. So this is a great way to disseminate this information. And this program is very, very different. And I think it's really going to come into focus as we get closer in to the fourth quarter and the marketplace disruptions that we're going to see. It's Hy-Vee Exemplar Care. The website is exemplar.care. Really simple, exemplar.care if you want information. So now we're going to talk about large employers because I've focused a little bit on small employers. Quick Trip was one of your first clients, okay? And now, how many employees?
They have a lot of employees, but on their benefit plan, it's around 24,000, and we're taking care of folks who are in the clinic areas where we've built out clinics.
That's remarkable. Obviously, just hearing that is an endorsement into your quality level of what you do. I shop at Hy-Vee. There's 151st and Olathe. I'm in there multiple times a week, okay?
Thank you.
Great people, great. I've never been to a grocery store where they literally stop whatever they're doing and I need to know where I can find this. And they walk you to the aisle and show it to you. That's the way the employees work there is completely different. For them to have that kind of faith in what you're doing and to be able to take their employees and send them to your facility, I think that speaks volumes for how this works.
Absolutely. And I think we are actually headquartered in Des Moines, Iowa, which is where Hy-Vee is also headquartered. And our first clinic in our West Des Moines headquarters clinic is also 24/7 urgent care. So with Hy-Vee and the types of employees and the demographics, and then we've got shift workers, that absolutely works for them just as well. That, outside of ours, they can connect with their primary care provider, or they can come into urgent care if they have those acute needs. We do offer fee for service as well in the urgent care, so we have non-members, but our members get priority. They can walk in and they're the next one to be roomed when a room becomes available.
So when you say 24/7, you really mean 24/7 brick and mortar urgent care?
Absolutely. We opened our doors there nearly 5 years ago now, and we've never closed those doors since.
We missed a shift, and as we grow out and the markets mature, we're going to have it in Omaha and here in the Kansas City market as well.
That's pretty remarkable because that's not something you typically see. And again, the employees are coming in. There's no copay for them. There's no out-of-pocket costs for them. Am I going to be able to afford the copay? Well, I'll wait a couple of days because I'd rather see if I'm not going to have this problem or the problem gets worse because they don't want to pay the $50 or $75 or $100 copay. This is completely different.
Well, and even more so at night, those employees would often be stuck going to an emergency room. So now you have hours of time lost, thousands of dollars spent out of their pockets, and even more out of the large employer level funded self-funded folks who are paying the bill however it comes in.
And it is the least effective dollar for healthcare spent in this country.
Absolutely.
Yeah, and it's unfortunate, but that's what you said is absolutely correct.
Yeah, they all understand zero. So they all understand zero, and we all know that accidents never happen when we want them to happen. They're always going to be at night or at the weekend or during the holiday. You know, you're at the barbecue with your friends on the 4th of July and something happens. Where do you go? Emergency room is usually your only option, but no, we can do the virtual care if needed. If virtual care will manage the situation, we can do virtual care, or they can come into the clinic for that 24/7 treatment.
So on the break, you were talking a little bit about the experience for the employee and what you have learned over the years with how the employees feel about this program versus being on a standard ACA type health insurance program. Talk a little bit more about that, Jackie, because it was fascinating.
Yeah, no, what we find is that a lot of these employees, they've not necessarily had regular checks. So what we actually say to them, some of them are unsure and they feel that when they're coming to a doctor's office, maybe it's a little bit more judgmental. They come and they visit our clinic and people have got the time for them. They build that personal relationship with them and it just feels more real. They're coming and talking to a friend. We also say doctor in your pocket, or that small town doctor who knows your family and knows who you are and what matters to you. We want people to live their healthiest lives. So if that's playing with your grandchildren, it's you want to continue to be golfing, or whether it's that you just want to go and sit and meditate and have coffee with your friends, we will work with you on whatever health means to you. And what we do is during that welcome visit, we will take those baseline labs, we'll have those initial conversations of what health means to you, and then we'll make sure that we keep your health where it is today, or we'll help you to improve. This is all about proactive, preventative healthcare rather than the sick care that we have across most of health.
We have the time to dig into it all. If you come in and you've got a couple things you want addressed, one of them, you might be tired. You're chronically tired. You work shifts. Your sleep's not very good. You don't eat very well because you work at Quick Trip in a convenience store, or you get off work at 2 a.m. and there's nothing available and you can't cook. We have the time to sit and go, okay, let's look at, first off, yes, we need to figure out your sleep schedule. Go through all of that. That can be a 10-minute conversation. Then you move on to the diet and the exercise. The exercise is going to help sleep. I remember in the fee-for-service world, I would get people who would come in and I'd be like, yep, you need to work on your diet and exercise. You shouldn't become diabetic. That would be bad. Thanks. Have a nice day. Done. Visit over.
7.5 minutes.
Correct.
7.5 minutes.
And
you're out the door.
Now you sit and have a conversation. You say, okay, your A1C comes back at 6.0. You're pre-diabetic. You could become a diabetic if your A1C gets to 6.5. You're on that trend. I could give you metformin, a medication that treats diabetes, and we can relative risk reduction of about 16. Or you can make wholesale lifestyle changes. And now I can talk about intermittent fasting, low carb food options, the types of exercise that decreases the likelihood of progressing to diabetes. And that's a 32-fold relative risk reduction, twice as effective as me giving you a medication. One of those takes time and effort to explain. The other one takes writing a prescription and moving on.
And that's the 7.5 minute business.
And half the patients will say, I kind of like that pill idea. But this is where you get a chance to really show them that you care about them and educate them, like your health matters. And if you make these changes, you can head off one of the most costly long-term diseases that you can have.
And that comes back in cost to the employer, and it comes back with satisfied employees, and it comes back with the overall health of his workforce and how they feel about that employer, which goes back to that comment you made earlier in the show. This is the one thing my employer does.
You notice what this is, though, Cary? This is alignment. So my goal is to make you healthy. Your goal is to be healthy. The employer's goal is to provide a good benefit and to save money at the same time. All these things are in alignment, where in a fee-for-service world, the more you come in, the more I get paid. You have disincentives and misalignment that cost people money over time, and this is a way to remedy that.
And I think that's a great way to wrap this up. You just heard it from Doctor. It makes perfect sense. This is an alignment. It's an alignment that works. I urge you to take a moment to go to their website and take a look at this. Exemplar.care. Exemplar.care is on the website. All the the information is up there. If you're an employer, if you're a human resource director and you're looking for an alternative, or you're going to get a significant increase next year, or maybe you're just not happy. You're not happy with the program that you're on. You're not happy with the carrier. You're not happy. Your employees are not happy. You've been cost shifting and doing all these different things to try to make it work. It's just not working. This model works. Okay. Hy-Vee and Quick Trip wouldn't be doing this with thousands of employees if they didn't think it worked. That's why I asked these folks to come and do this show. We try to provide information here about things that are different on the cutting edge of healthcare. This program is different. The website, exemplar.care, exemplar.care's website, all the information is up there. And now I leave you with this thought from Albert Einstein. The one who follows the crowd usually get no further than the crowd. The one who walks alone is likely to find himself in places no one has ever been. Remember, friends, it's a funny thing about life. If you refuse to accept anything but the very best, you most often get it. Thank you for listening to America's Healthcare Advocate Show, broadcasting coast to coast across the USA. Goodbye, America.